Hi everyone, thanks for joining us. This is a follow-up to the webinar we had last Friday about the importance of having a mind-eye connection. We had so many great questions that we just needed to do a separate session to answer some of the overflow questions that you guys had. So without further ado, here's Dr. Zielinski. And the first question is, my child with autism and OCD wants to know if the special glasses will remove bad repetitive thoughts, images, and sounds from the brain and get rid of any self-injury or fight or flight response.
Well, that's a good question. There's no guarantee that there's magic glasses that will all of a sudden make bad thoughts disappear from somebody's head. On the other hand, usually bad thoughts come when your brain is on overload and stress. So we discussed during the webinar that you have kind of a stress bucket, and there's a threshold to it, and it's a brain budget. You have so much stress that you can handle, and when there's more stress, you go over the edge. And what we can do is use glasses to lessen the overall stress and keep somebody from pushing into fight or flight mode, which hopefully would lessen the stress chemicals that were being produced. There'd be fewer being produced, and change their thoughts and thinking.
Great. Another question. I have congenital nystagmus, which has seriously impacted my eyesight and my emotional being. I understand the condition as stemming from the brain physiologically. I would appreciate learning how you view this problem. I'm a long-established teacher of natural eyesight improvement and find the mind-eye connection to play a very big part in most eyesight challenges.
Well, nystagmus is fascinating because I've seen patients with nystagmus who are legally blind. And so nystagmus, for those of you who don't know, is where the eyes are uncontrollably moving, either side to side or up and down, depending on what type of nystagmus. Sometimes it's acquired after an injury, and sometimes it's or a tumor or something, and other times it's congenital. This person is saying it's congenital, so he's had it since birth. I've seen many patients with the nystagmus who see 20/25 or 20/30. So I don't know which of the two you are, the one who sees clearly or the one who doesn't. But either way, you're saying that the nystagmus has impacted your eyesight, and can we do something about it? So it totally depends on how much it impacts. It has to do with your inner ear and your neck muscles and your eye muscles. They typically, in non-nystagmus patients, when your head position changes, if it tilts or tips or turns, your inner ear moves, gets more different signals. It doesn't move, it gives different signals. And when the inner ear says your head is tilted, your head is tipped forward, your head is rotated, then those signals get sent to the eye muscles so they move. In somebody with congenital nystagmus, those signals are being triggered even without a head movement present. So they could just sit still and the eyes are still getting conflicting signals. The bottom line for that is we can work with you but not get rid of the nystagmus. There is a null point, and we could put glasses that pushes you into the null point through a reflex, but that would only be if your head is in a particular spot and your eyes are in a particular spot. It wouldn't hold true if you're scanning the environment. So I don't know that we would, depends what you want to be helped with. I don't know that we certainly cannot eliminate the nystagmus if it's congenital, but we might be able to make the scanning ability of the surroundings a little bit easier, or make you be able to glimpse something, hold the information in your head without having to fixate on anything directly.
Great. Do you have any studies on migraine aura?
I don't have any studies on migraine aura, but there's a man named Arnold Wilkins in Oxford and Cambridge. I think it's Oxford that he's in, who has it. Arnold Wilkins, Wilkins. He is the inventor of a colorimeter. He is done studies on migraines and colors for decades now. So look up his research.
Great. How can double vision, color distortion, cataracts, diabetic retinitis, and depth perception issues be addressed together?
All in one? I'm going to assume that's an older patient. Do we know the age of the patient?
No, not off the bat.
Okay. Well, depth perception is the ability to pull a figure out of a background and know how far away the figure is from you and from the background. So double vision is when that system isn't working well. So two of the things you're talking about, the double vision and the depth perception, go hand in hand. If you have double vision, you lose depth perception. You'll have double vision when the peripheral sections of the right and left visual circuits don't link together. So then you ask about color distortion, cataracts, and diabetic retinitis. So color distortion is when the center part of the eye is not intact. But cataracts, which block the light that's entering the eye somewhat, can create a color distortion. Diabetes, which makes blood thicker and blood vessels thinner, can also create distortions because there can be swelling in the center part of the eye. So when people have like a precursor to diabetes, they lose some color vision abilities with blues and yellows, and then when light has been blocked from a cataract, they also lose some color perception. So we can't address the color perception per se. We can address the double vision, we can address the depth perception. And as far as the diabetic retinitis, there's so many aspects to that. If it's in the center, and they call it central macular edema, the center of the eye of the retina is swollen, and that's going to affect how you see targets. There'll be a distortion. But if you have just little blood vessels that are broken around the periphery of the eye, because the diabetes affects tiny blood vessels, which are all over the retina and the kidney, we can't address the actual inflammation in the retina. We can't address the blood flow, but we can address how much of the retina is left over that's healthy tissue, and teach you how to use the leftover retinal tissue and ignore some of the central tissue. I directed a clinic for legally blind people for years and had a macular connection program, and that's all we did was teach people a new way of seeing. The person who is being described here might have had 40 or 50 years of seeing a certain way and using the center part of their eye. Then the cataracts lessen the input, the diabetic retinopathy lessens the quality, and the macular edema and the color vision loss distorts the acuity also. So I think from that type of a patient, we would do three things. We would teach you how to use the peripheral parts of your eyes differently. We would give you glasses that would allow you to see the environment so that you wouldn't have double vision. And then we would give you games to build up visual skills that have been lost. But we wouldn't expect you to have crystal clear eyesight because of the cataracts and the macular swelling.
Great. And this is the last one. I am grateful for this opportunity to ask some questions, Dr. Z. Thank you very much. I have a question, and it's as follows. I am studying, and I am behind. I want to move forward, but it's very difficult. And also, my eyes don't see clear and bright the way that I should. Thanks so much, and keep well.
That one's an interesting question, because that sounds like somebody who's younger than the diabetic patient. The neat thing about visualization and vision is that vision is a giant topic, and eyesight of letters on a chart is one little piece of it. So when you look at eyesight, there's the central eyesight of seeing a target, and there's the background of what you're aware of. So for this person who's not seeing clear and bright, that's implying that the whole retina is not lit up and activated. Just a little part is. When the floodlight aspect that we talked about in the webinar is activated, the awareness improves and it increases. When the attention on a target and the awareness of the background are in a team together, working as a team, everything they look at seems brighter and clearer. There's also the corresponding process inside the head. So internally, there's no limit on how you can perceive details and think about them or concepts. So for the person who's writing this question, they're saying the outside of their eyesight is not clear, it's not bright, they're having problems, but it sounds like the eyeball itself is intact. So contrasting to the previous patient with the diabetic retinopathy and the cataracts and the poor depth perception, this one sounds like somebody who has an issue internally, and the internal processing and how he thinks about things affects the external clearness and clarity. So the answer to his question is, what can we do? We could help you work internally, thinking differently, and visualization and imagery games and building up visual skills that would allow you to learn to scan the environment in front of you and be more aware. Turn the floodlight on instead of the pen light.
Okay, great. Well, that was it. That was the last of them. So thank you very much, Dr. Z, for getting to these overflow questions from the other day. I'm sure these people would appreciate having their questions answered. So.
Well, thank you, Colin. It's nice that everybody does get answered, and you're going to be sending this out with the actual webinar. So I know from my end, I've been on webinars where I've typed out questions and they never got addressed, and it's not fun. So we hope to help everybody if we could, but people have to realize there's not a magic pair of glasses that poof, your brain is better. That you have to rehearse the new skills, you have to build up skills. The newest neuroscience research that was just out yesterday is talking about retinal processing and how the brain has biases. They're building artificial eyes and using artificial intelligence to mimic what people do when they see. And they're finding out that before the brain even gets information, the retina and the signals going on in the retina are rearranging things to alter perception. And the perception is driving cognition. So it's fascinating research. It's an incredible field to be in. So thank everybody for tuning in.
Awesome.